Client education. Client education is ongoing, goal-driven, and it is an interactive process that provides clients with new information that may be related to medications, treatments, health conditions, promotion of health, or the prevention of various disease processes. The Joint Commission made education a requirement for hospital facility accreditation. Nurses provide education to clients and their caregivers, and this in turn assists them in the improvement of their care and their health status. The documentation of education is very important because it is the verification of care that assists to assure safety and continuity of respect for the educational needs of the client. Documentation is used for reimbursement of services and can possibly lead to decrease in staff and services. Using the nursing process will help ensure well-directed and precise documentation of educational activities. The nurse will develop a plan to educate the clients according to their literacy levels and using cultural competence. Once that plan is determined, then each intervention will be implemented. The nurse will evaluate the client's learning and revise the education that was delivered if it is necessary. The purpose of client education is to provide the clients with the knowledge needed to make healthy lifestyle choices. There are 3 domains of learning: cognitive, affective, and psychomotor. Cognitive domain consists of knowledge, which is recalling prior learned information, the comprehension of the knowledge, which is understanding and interpretation, the ability to use the information, which is application, being able to analyze or break down the information to understand its structure, synthesis or putting the elements of the education and information together to create a whole, and evaluation or deciding on the ideal of the ideas presented. The affective domain is based on emotions and involves feelings. During education, the clients need to evaluate their own values, attitudes, and beliefs to process the educational material and then to apply it to their situation. The psychomotor domain is based on action. This may be physical movement, skills, coordination, use of their senses. This involves hands-on skill teaching for the client. Knoll's fundamental principles of learning include relevance. So the adult needs relevant information. Learning should be self-directed. This permits the client to take part in their learning and control making informed decisions. This also helps the client to accept responsibilities for the choices that they make and then the consequences of those choices or their actions. For life experience, the clients are already equipped with existing knowledge that is gained through their life from academic and personal experiences. The client will use learned past life experiences as a foundation to build and influence their learning with new education. Readiness. The client must be ready, willing, and able to learn. This cannot be forced because that will impede their learning. Task-centered. Adult learning tends to be task or problem-centered learning. The education is more effective if it relates to the adult's life experiences. Motivation to learn is both internal and external. Internal motivation is vital because this increases self-esteem, and it is an actual measurement of the accomplishment. The external motivation is upon the client. However, the client has to be internally motivated for learning to take place. Client health literacy is the ability to obtain, read, and understand health information that is needed to make healthcare decisions. This is a lifelong process that is continually developing. There are various barriers that can hinder client education. These barriers may include impaired cognition, language barriers, visual or hearing impairments, emotional concerns, cultural differences. Negative emotions like fear, anger, or anxiety may affect the learning process and block opportunities. Non-judgmental support is necessary for learning. Nurses follow the ethical code, which is respectfulness, empathy, and non-judgmental views toward clients. If there are disparities and there is not non-judgmental support, this will or may affect the outcome or the treatment for the client. Nurses need to use self-reflection of their own implicit biases and become aware of their personal thoughts and behaviors. A low stimulus environment is necessary for learning because this will provide good ventilation, adequate lighting, comfortable temperature, and decreased noise level. Learning is best if it is repetitive. Repetition provides the same educational information to reinforce that that information is conveyed. This will permit the gaining of self-confidence, knowledge, and it allows practice in applying the learned material. The cognitive domain is intellectual learning, and it encompasses knowledge, comprehension, application, analysis, synthesis, and evaluation. It is basically the nursing process. This can be provided as lecture, which allows the individual to gain comprehension and knowledge. It allows teach back, feedback, and evaluation through question and answer. And it can promote active participation, peer support, or application of the material to real life through discussion. The affective domain is emotional. This involves values, beliefs, and ideals. For the affective domain, there is a receiving of the information. There is responding to the information that is provided. The client must value the information. They need to organize their values and understand and resolve their conflicts, and this helps them to form a stronger value system. They need to have goals. So this can be accomplished through an interaction of dialogue related to personal topics, expression of feelings, and support. It can also be accomplished through active engagement of feelings, attitudes, perceptions, or values. The psychomotor domain is an accomplishment of physical skills. It is necessary that one has good perception and is aware of nonverbal cues. The individual must be ready to learn physically, mentally, and emotionally. Imitation can be used to help guide responses. The individual will become more secure throughout the learned skill with practice. Adaptation is when the individual takes the skill that is learned and they adjust it to the situation as required. The psychomotor domain can allow the individual to see the expectations with demonstration, and with a return demonstration, it allows the individual to perform the necessary skill with feedback from the nurse. Teach back is considered one good educational strategy. This is where instruction is provided to the client. Then the client is asked to explain the information back to the nurse in their own words. The nurse will then evaluate the level of understanding of the teaching and identify areas of weakness for further instruction. Ensuring that the client fully understands the educational material is important for safety and their adherence to their treatment plan. Nurses that consider the individual's needs and characteristics are able to deliver educational material more relevantly and engaging for the client. This will help produce an increase in the client's learning and improve their educational outcomes. A teaching plan is similar to the nursing process. The assessment, analysis, planning, implementation, and evaluation. The vital difference between the two is that the teaching plan focuses on learning needs, the client's motivation, and the client's ability to learn. With the assessment phase, this is the nurse is gathering data to determine the learning needs, the client's readiness and motivation, the resources that are available, the health literacy, if the client has any learning disabilities or learning preferences, considering cultural beliefs, the medical history. The analysis is where the nurse will analyze the information that was obtained to identify the learning needs and prioritize those needs. The analysis phase helps guide in goal setting and the nursing interventions. The planning phase uses critical thinking to help develop an individualized teaching plan. This is where there is an identification of the expected outcomes or goals of the education. Client-centered and SMART outcomes are designed to make sure that the education is presented to the client in a mannerism that they can understand and achieve the value from it. SMART outcomes are an acronym meaning specific, measurable, attainable, relevant, and timed. The use of the SMART acronym will supply a method of measurable indicators to assist the nurse to evaluate which goals the client has met. The implementation is the performance of the nursing interventions to help meet the learning goals that were identified during planning. These interactions can be a verbal discussion, demonstration, providing printed materials, videos, or teach back. With evaluation, the nurse is determining whether or not the learning goals were met and what part of the learning plan, teaching plan, may need revised. If the goals were met, then the plan does not need to be revised. A nurse needs to frequently evaluate the progress toward the attainment of the goals for the education with the client.